Hello everyone, I'm Dr. Sahim Soukaina from Morocco. I'm so glad today to participate in this third virtual international multidisciplinary conference on current research. I'm going to present a study that was conducted in the Department of Orthodontics at the Faculty of Dentistry of Casablanca of Morocco, entitled Perception and Satisfaction of Patients Treated with Orthodontic Clear Aligners. In recent years, invisible orthodontics has been one of the concerns of both orthodontists and patients. Since their appearance, studies about clear aligners were focalized on the description, the operation mode, the biomechanics, and the efficacy of this system. However, there aren't many published articles about patient satisfaction. The main purpose of our study was to evaluate the perception and satisfaction of patients treated with orthodontic aligners in the private sector of Casablanca in Morocco, in order to shed light on the strong aspects and the weaknesses of this treatment modality. We have conducted a cross-sectional descriptive study in private dental practices in Casablanca from December 2018 to May 2019. For the inclusion criteria of our sample, they were included patients treated with orthodontic aligners in exclusive orthodontic practices in Casablanca, and patients who have worn orthodontic aligners for at least 1 month. For the exclusion criteria, they were patients with specific needs and patients in the pre-treatment phase for aligners. A total of 68 patients was included in our study. Concerning the data collection, we used a questionnaire comprising 4 distinct parts: the general patient information, the choice of treatment, the patient-practitioner relationship, and the patient satisfaction with the aligner, especially duration, aesthetics, comfort, and pain. Now let's move on to the results of our study. For the socio-demographic characteristics of our patients, they were more female than male in our study, with a percentage of 80.9% of female. The young adult age was the most predominant age group, with a percentage of 55.9%. Most of patients were satisfied to very satisfied with the explanations provided concerning the treatment. They were also satisfied to very satisfied with the treatment duration and the wearing duration of each aligner. Concerning the satisfaction with aesthetic of aligners, attachment, teeth, and facial aesthetics, all these parameters satisfied our patients. Concerning the response of aligners to patient expectation, we have studied the improvement of teeth appearance, facial aesthetic, teeth health, self-confidence, and chewing and pronunciation. Patients were mainly satisfied with the improvement of teeth appearance with a percentage of 77.9%. The majority of patients were also satisfied with aligner comfort, the ease of hygiene, the intervals between appointments, and the duration of chairside control. Now we're going to see the inconveniences noted by patients by wearing aligners. The most predominant inconvenience was the pronunciation problem, followed by mucosal injuries and allergic reaction. What about pain? 63.2% of patients felt pain. It was mainly felt when removing the aligner, with a percentage of 42.6%. The pain was limited to 1 to 2 days in the majority of patients. Pain was in general tolerated, and only 4.4% of patients took analgesics. Now let's discuss our results. Our study showed a predominance of the female sex at 80.9% among patients treated with aligners. The mean age of patients of our study was 34.7 years. According to the literature, patients seeking for orthodontic treatment with aligners are generally aged between 28 and 38 years. 98.5% of patients were satisfied with information provided regarding the treatment. Satisfaction with the duration of treatment was around 70.6%. The Mayer study found that 41% of patients accepted treatment duration of 1.5 years and 25% accept after 2.5 years. Patients in our study were generally satisfied with the wearing duration of each aligner. The wearing duration in our sample varies between 1 week, 10 days, and 2 weeks. According to Alansani and al., the recommended wearing duration for an aligner was 2 weeks. One of the biggest benefits of aligner therapy is invisibility. 92.7% of the patients in our study were satisfied with the invisibility of the aligners. Satisfaction with the aesthetics of aligners was also correlated with the aesthetic of attachment. The majority of patients were satisfied with the comfort of the aligners, the ease of hygiene, and the appointment duration. 92.7% of patients were satisfied with the time necessary to see the first results. Patients in our study were also satisfied with aesthetics of the teeth and their facial appearance. Now we're going to discuss the discomfort caused by aligners. The main discomfort noted by patients after wearing aligners were related to pronunciation problems, mucosal injuries, and allergic reactions. Pain was reported by 63.2% of patients, and only 4.4% of them took analgesics. Nedwanandol noted that 53.7% of patients felt minimal pain and 11.1% felt severe pain. Pain was in general limited to 2 to 3 days. In conclusion, when the growing interest in aesthetic appearance, hair aligners represent an alternative to conventional fixed orthodontic treatments. Patients who have received treatment with aligners are generally satisfied. Nevertheless, there is some inconveniences following the wearing of aligners. Thank you for your attention.